welcome to the Be Well video blog. I'm Chloe Robertson, your host. Be Well stands for Behavioral Health, Wellness, Environments for Living and Learning. Today on the vlog, we have with us Dr. Lovoria Williams, who is an associate professor at the University of Kentucky College of Nursing, and she's here with us to discuss motivational interviewing. Hi, Dr. Williams.
Hi, how are you today?
Good, how are you?
Good.
Our first question for you is, what is motivational interviewing?
Wow, that's a big question for such a complex style of conversation. But simply motivational interviewing, it's a way where the clinician and the client communicate to one another in a way where the clinician helps the client explore their reasons for change, where the client is the expert and the clinician is also the expert. But it's where the clinician helps the client understand reasons for change and helps elicit from the client reasons why they should be motivated to change.
Mm-hmm. And in what areas has motivational interviewing been used effectively?
Motivational interviewing has been used effectively in many areas. It's been used in addiction behaviors for tobacco treatment. It's been used in weight loss interventions. It's been used in any situation where an individual wants to change their behaviors or the clinician believes that what the individual is doing may affect their health in a negative way, and they want to guide the individual to change their behaviors.
So, Dr. Williams, in what clinical situations is motivational interviewing most useful?
Any clinical situation where ambivalence is high, desire is low, motivation is low, and confidence is low. So that could be in the case of tobacco. The individual uses tobacco and the clinician is trying to have a conversation about the individual, about changing their tobacco use behaviors. So the individual may be ambivalent because tobacco helps them. It helps them when they're stressed or it helps them calm down. And so they're ambivalent. They know the information about the ill health effects, but they still are ambivalent about changing their behavior. Or, again, in the case of tobacco, they may have tried before, so their confidence is low because they perhaps have tried unsuccessfully before. And their motivation could also be low because, again, they desire it. And then their desire may be low because they have some pleasure from using tobacco. So any clinical situation where those four factors exist.
And do you have any final comments about motivational interviewing or the tools that are used for motivational interviewing?
I think the main takeaway about motivational interviewing is understanding that there's no prescription that the clinician gives the patient, that the patient has already heard that tobacco use is harmful to their health. They know that information. They know in their minds that they should quit. But the difference with motivational interviewing is that the clinician just doesn't simply tell the person to quit. What they do is they have a conversation with the patient where there's understanding about the barriers to quitting. They learn from the patient the things that they've tried before, what worked, what didn't work, and they help the patient understand that they are an expert in their own health. They are an expert in the things that they've tried before to quit using tobacco, but that the clinician is also an expert in the information that they have about the health effects of using tobacco. But they're both experts, and doing the exchange of listening, being empathetic towards the patient, and helping them understand that we're in it together to help them quit tobacco, that it's not just a prescription where the clinician says you should quit smoking. The patient already knows that. But it's just helping them understand that within themselves, they do have the resources to quit.
Yeah. Well, thank you for your insights into this very complex topic.
Yes. Thank you.
And if you would like, or if you're interested in learning more, please check out our website at www.bhwell.uky.edu. Thanks for tuning in to Be Well Vlog, where behavioral health is our priority. See you next time.